Welcome back, everybody. You're listening to Westchester Talk Radio, which is produced by Shark Creative and made possible by Entergy, Indian Point Energy Center, where they are literally helping to keep the lights on and supporting the community as they always have right through April of 2021. Also, Lapolis Electric, where you're never left in the dark. They're doing a great job offering 24-hour emergency services and are truly on top of the COVID-19 pandemic with taking all the precautions needed to provide a safe and healthy environment. Check out their podcast series called Livewire, which is produced by Shark Creative and found on demand at lapoliselectric.com. Well, we have Isolation Therapy episode 20 today, along with our good friends over at Forme Urgent Care. We have the founder and president, Gina Capelli, and also the CEO, Maria Trusa. What a pleasure to see the both of you. As it always is. And I welcome you to our show. I welcome you to Westchester Talk Radio. No strangers to us. I know we've been there before. We've had you on somewhere along the past. But look, we've got a lot going on right now, and you guys are truly on the front line of what's happening in Westchester County. And, I applaud you. Honestly, I really applaud your efforts. I see some of the things that you're doing, and it's really quite something. But you, I would imagine, can share a lot with us today, and we want to get right into it. Ladies, first of all, how are you feeling? How are you doing personally?
We are exhilarated. We're tired. We're working long hours, but the amount of people that we're touching, the lives that we're touching, is really, it keeps us going. So, I feel great. Maria, I'm sure Maria agrees with that one.
Absolutely. Gina and I were talking the other day. We normally are at the front line from 8 to 5. And then we go, now I go to Gina's house because I'm not even seeing my daughter because I'm actually working with the patients that are coming to be tested for COVID. And we were saying how we are exhausted. I mean, you can hear it in my voice. We are exhausted, but it's a weird energy. It's almost like divine energy in a way that just keeps us going and going nonstop.
Well, that also speaks a lot to you guys and who you are and your personality and everything that goes along with that. But tell us, how did you get involved in the testing? Why did you do the COVID testing in the first place? And how did you get involved in it? And is this something that's funded?
So we, Maria and I, as you know, Forme Medical Center handles a lot of the underserved, uninsured community. Most of this population are the immigrant population that don't have access to care. They don't have access not only to medical care, but they don't have access to testing. There's a lot of barriers that they have to face, one being identification, the other being a car, being able to drive through these test centers. And we realize that this population isn't being tested, and they live in houses with multiple people within their family, and the spread is just becoming widespread because of the conditions that they live. Maria.
Yeah. I remember Gina and I were discussing how we were getting 300 phone calls a day. 90% of those phone calls were people with COVID-like symptoms. And the doctors were calling us and saying, where do we send them? And I kept calling the Department of Health. Gina kept calling other places. And we were like, we couldn't find a place to send our patients because, like Gina said, they didn't have a card, they didn't have an ID. We have a lot of the immigrant population, and we couldn't test them. And at one point, we were like, I remember crying. I'm like, Gina, what do we do with this? We have to do this. And together, we're like, let's do it. We don't care how we're going to do it. We don't care where the money is going to come from. We're going to find out because we were not going to be supported. We are a mission because we're in Article 28 and we are not a nonprofit, although we have a nonprofit. And we joke around because we work like a nonprofit budget because what we do for the community is providing healthcare at the lowest cost possible. Most of the time, Gina and I are funding it. So we decided we're going to fund this too, and we'll figure it out. we've been blessed because actually we've gotten donations of PPEs because we couldn't do it without that. So we just knew that we had to take this in our hands and be able to help this community. And that's where the divine energy comes from, like you were saying. Gina and I we just figure it out. That's who we are.
So you're not getting funded for this. This is something you're doing.
We're not.
Yeah. And you couldn't have seen this coming. I can't imagine, right?
Nobody can see something like this coming. I mean, the whole country, the whole world didn't see this coming, and how it hit so hard, especially in New York. New York was hardest hit, as you know, and Westchester is considered one of the hot spots. And we're just there to be able to help as much as we can.
Gina, why do you think the Latino population was hit so hard?
Because, like I said before, they don't have any place to go. We have become the resource for this population. They come to us for all their medical care, not only medical care, anything they need. We seem to be the place where they go to get their questions asked or answered, I should say, and we become the resource for them. These people don't have other options. There's no places for, they can't afford healthcare. Healthcare has become extremely unaffordable, and actually, it's the #1 cause of bankruptcy in America, and I don't know if anyone knows that. But healthcare bills can break a family, and not just a Latino family, our whole country.
Yeah, I mean, I think no doubt about it. I was talking yesterday with people over at Feeding Westchester, which you got to see what's going on over there. I mean, there's about 1 million people that live in Westchester County. They were telling me yesterday there's about 500,000 people that they're seeing going in and out of those doors as of late. So I don't think people realize how many people in our community. I mean, here we are in Westchester County, so you don't think about the areas that need the help as much as they do, and it's probably more rampant than we want to admit. But anyhow, you guys should really be commended for what you're doing and everything that you're doing to put yourself at risk to certainly a certain degree. Let's talk a little bit about the testing for the antibody. Tell us about that. What's going on behind the walls over at Forme regarding the antibody test?
So with one of the things that we realized that aside from the COVID testing, which is one of the reasons we started this, we actually were not even thinking about the antibody testing. The COVID testing is so important because people need to know that they have the virus. We're seeing the community come in and they don't realize that they have the virus and how they can continue to infect their families. But aside from that, people need to know if you already built the antibody. Like Gina can talk a little bit more about this because she actually had the virus and have the antibody. So we joke around Gina is Superwoman because she could go anywhere. Like we're separating the COVID-19 testing from the antibody testing. When I'm at the front managing, and the reason I'm at the front is a lot of the community speaks Spanish that is getting the COVID testing. So Gina doesn't speak Spanish. If she did, she'll be there because she's Superwoman. But it's, you're sort of, the idea is that you are protected, that you are able to get back to work. And that's why a lot of the people, we're getting a lot of people that have businesses that they're sending their employees to us to be able to get tested so that if they have the antibody, the goal is that you can go and start living a little bit. Obviously, you still have to protect the people around you, but you don't have to worry as much.
We need to open the country again. We need to open the state. There's a lot of people that are out of work that, as you said, look at the food lines. People that never needed this before are in such need of food because they can't work. So we're actually talking to some of the big corporations to be their advocate, to go and test their employees, because once you have the antibody, it's a safer feeling. I have a different feeling than Maria does. Maria can't see her daughter. I can see my daughter. I'm not going to pass I'm not going to pass the virus off to her. And I'm hoping that I can't get reinfected. Word is that you can't, 90 something % chance that you can't, but you never know. This virus is a very scary virus.
Yeah, I mean, we're certainly hoping that, but we really don't know, right? There's a lot we don't know about this yet, and and we're not going to know for a long time. It seems like, but you're doing everything you can do. Gina, before we break, tell us a little bit about, since you had it, is there anything that you want people to know? What did anything you can share from personal experience about having COVID-19?
Well, first I have to say, it's a very scary feeling because I'm asthmatic. So that is, the whole, everyone in the company was like, you cannot get it. Maria's like, I should get it. You cannot get this virus. And unfortunately, I was the only one that got infected. And when I got infected, our doctors actually put me on the dual medication, the hydrochloroquine and the Z-Pack, as soon as my first symptoms started, because they were afraid that this was going to escalate and I was going to be one of the candidates on a respirator. I truly believe, Andrew, that starting that medication early has actually saved me. It's a scary feeling. And then, knowing that Maria came to see me, she was 10 feet away, just checking on me, constantly checking on me, calling me every day, every hour of every day to make sure I was still okay. Because the point is that you never know. And then when something like this happens, as we were saying before, I go to the hospital, you don't get to see me again. You don't get to see me until I'm checked out. So whether I survive or don't survive, that could be the last time we see each other. And it's a horrible, horrible feeling.
Yeah, that is really one of the things that's the most chilling for, aside from the fact that, first of all, people have different reactions to it. There's a lot of similarities, I suppose, but still everybody's gets it a little differently. And then, God forbid that you're put in a position where you're not able to say goodbye to a loved one. That really is one of the scariest things about it.
Yesterday, Andrew, we had we were just talking about it this morning, Gina and I. It was a really rough day. We had an 88-year-old woman that came in with her aide, and the lady had a fever, and the aide is in a wheelchair trying to help her, and the lady was weak, and I'm out there helping her. She had her mouth open, and we're like, oh my God, she has a fever. It's feeling achy, and so is the aide. So this is the first thing is she has COVID. So we start doing the vitals, because one thing that we're doing differently, you don't come to us and you just get tested. We check your vitals. We want to know what your oxygen level is. If you're not feeling well, if you have an oxygen level below 95, then we know that you need help. You're going to have to go to the emergency room. So we did her vitals, and we realized that her temperature was 103 and she had 92 oxygen level. Immediately, we called the ambulance, and we called her son that lived nearby. And I'm seeing this picture of her son, probably could be for the last time seeing his mother. And he says, but she doesn't speak. I need to go with her. They're saying, don't even go to the emergency room because they're not going to allow you. You're not going to go to the hospital. Say goodbye now, because you're not going to see your mother for a while, because you can't go in. It was heartbreaking. Oh my God. I'm like, if that was my mother. I mean, my mom, I actually said, thank God my mom passed away 2 years ago, because I was able to bury my mom. I was able to do a mass for my mom. We were all there. But you can't even do that now. It's hard.
I can't even imagine. And with Mother's Day tomorrow, and people in that circumstance, it's just unfathomable. I can't imagine it. But I want to remind people, you are listening to Westchester Talk Radio, which is produced by Shark Creative. We are with the founder, president, and CEO of Forme Urgent Care over in White Plains off of South Broadway. Ladies, Gina Capelli, Maria Trusa, it's been a pleasure to see you both. I want to, again, remind you both to be safe and keep up the great work. We're pulling for you all, and certainly keeping our eyes out for you. And I enjoyed speaking with you this morning. I also want to thank our friends over at White Plains Hospital. I want to thank our friends over at Park Sterling Realty and also Hightower Westchester. Again, Westchester Talk Radio. This is Isolation Therapy, episode 20, produced by Shark Creative. We will be back again shortly, and take care, ladies.
Thanks, Andrew.
Bye. Thank you so much.